Some of you may not realize that there is a fairly new unit at TriStar that is specifically designed for young patients with cancer, a pediatric hematology and oncology floor that is new in our area. And Dr. Haydar Frangoul and Dr. Jennifer Domm are two of the kind of miracle workers there, I would say, with very special patients. And we're so glad that you came in today to talk to us about.
Thank you for having us.
Let's talk about this new unit and the kind of treatments you offer, Dr. Frangoul, if we could start with you.
Yeah, so it's really interesting. First of all, we like to thank the support we have received from Children's Hospital and TriStar Children's Hospital for building this new unit for our patients. This unit has 11 beds. The patients in it can receive state-of-the-art pediatric oncology therapy and stem cell transplant. The whole unit is HEPA filtered, so the air is safe for these children to breathe, and they are able to get out of the room and play. So with the patients there are safe from any infections because they are immunocompromised patients. But it's a brand new unit that has all the amenities that will make the stay for these children and their families very pleasant during that time of therapy that they'll be here.
Almost a home-like atmosphere with a play area for these children.
Correct. It's really amazing because some of these patients are coming from out of town and they have to spend 30 or 40 days in the hospital, so this is second home for them.
What type of treatments do you offer there?
Well, we offer the variety of treatment for pediatric cancers and blood diseases, as well as bone marrow and stem cell transplantation for patients that need a transplant.
So if they're there for the bone marrow transplant, then they may be there for quite a chunk of time.
30 to 40 days sometimes, yes.
Because they're immunosuppressed.
Correct.
And okay.
Correct.
All right. How are a lot of these cancers usually identified and diagnosed? Because I was reading in a little bit of the material, Dr. Domm, that oftentimes the parents, of course, don't realize that how serious the symptoms may be. They may appear to be other things, more common illnesses. Can you elaborate?
Sure. You're absolutely correct. A lot of times it's very difficult to tell what is serious and what's not quite as serious. The most common types of tumors that we generally see in pediatric oncology are leukemias and brain tumors. Those are the most common types. And so patients that have leukemia that are presenting with symptoms, they might have symptoms related to their blood counts. So for example, they might have anemia that might be quite profound, which may give them headaches, fatigue, not as energetic to do daily activities. They may have easy bruising or even some bleeding, like a nosebleed, for example, because of low platelet counts. Or they might just have persistent fevers because of their disease, a fever that keeps going on and on and on, and nobody's really found a particular source of infection, potentially. Also, definitely, if people have a brain tumor, they could have vomiting that's unexplained, they could have headaches, they could certainly have pain in any location too, depending upon where the tumor is. And in particular, the leukemia patients do often present with inability to walk because young children can complain about bone pain and not want to bear weight with walking.
Okay. Are there certain signs or symptoms? So actually, you've gone through some of those things, though, that parents might be able to identify, or certainly their pediatricians, if they took them to their pediatricians.
Well, I always say I think pediatricians have very challenging jobs. Anybody in primary care does, because a headache doesn't necessarily always mean that a patient has something as serious as a brain tumor. So I think wise advice is definitely, if you are concerned about a symptom that your child or a family member might have, definitely it would be worthwhile to talk to your primary care provider or pediatrician and go through the history and the symptoms together, and then together as a team help determine what kind of workup needs to be done.
Can you tell us about the research that you're doing at the unit in addition to offering treatments? So it's a research center as well.
Sure. So we are part of the Sarah Cannon Research Institute, and we offer clinical trials for patients with various types of cancers. Our group is part of a national group called the Children Oncology Group. We have more than 30 or 40 clinical trials that we offer for any variety of tumors or cancers that patients can present with. In addition, we have multiple supportive care as well as stem cell transplant trials that the patients are eligible for. So they truly, if they come, they are potentially can receive the state-of-the-art therapy, including experimental therapy for those cancers.
Aren't we fortunate to live in the area that we do and to be able to offer this to these sick kids? What are the survival rates? It sounds like from what we were talking about earlier that it's pretty encouraging that a lot of these children do very, very well. But the sooner they get there, the better, right? The sooner you can see them.
Well, I was just going to say, I think it obviously varies quite a bit depending, number one, on what your diagnosis is, of course, and then how extensive the disease is at the time that it's diagnosed. So generally it is better to find it earlier rather than later, particularly for diseases that metastasize and go to different locations in the body. So the earlier the better. That being said, though, we've made significant advancements in just the field of pediatric oncology, and so most of the time we have patients that have very, very good outcomes, and that's part of what's so inspiring for us to work with these patients and families, because they do well, and we hope to, follow them for years and decades to come.
That's what I always think, what a tough job you have working with these sick kids, but you said no, it's very, very inspirational to work with these children.
Absolutely.
And they're so brave.
They are very brave. They're very brave, and they are so. This happens to them. They of no fault to themselves, correct? So, and they are amazing. They are fighters.
They sure are. All right, and I know there's more information we've had on the screen, the TriStar Medline and acco.org for more information. Thank you both for taking the time.
Thank you for having us.
Thank you for all you do.
Oh, thank you.
Thank you.
All right, and we'll be right back after this.